Before I begin, I just want to recognize and acknowledge that how we got here. And how we got here was a lot of hard work from individuals that sit in these very seats right now. I know Delegate Hubbard, we were talking earlier about how this goes back to the Schaefer administration. I know when I was chair, we were working on this. Delegate Frush and Delegate Pena-Melnick has picked up the torch, and Veronica Turner and Melanie Griffin. And those of you on this committee, year in and year out, we've come to you and talked to you about Prince George's Hospital. And as the situation got worse, how do we find a solution? And I know when I was down here for the 8 years, we tried and tried and tried to figure out what, not a Band-Aid, but what was going to be the permanent solution to the hospital situation, which just wasn't about the hospital. And one of the things that I said, it was about health care. How do we provide adequate, affordable health care throughout Prince George's County? And thanks to the agreement we come up with, the MOU, is how do we start looking at a regional Southern Maryland hospital care? I said during the campaign, and quite honestly, a number of people thought I was crazy, that I wanted to find a solution within the first year of the administration. I didn't know it would be within the first 8 months. I probably would have said that during the campaign had I known that. But it does mean that, you know, it said, as my team, we were talking about it, it was the groundwork had already been laid before we got in office. And that is, at the state, you have recognized for years that there had to be a permanent solution, that you had to bring everybody together. The governor, the lieutenant governor, the secretary of health, the county chair coming in and new leadership at the county level, Chair Turner. The only missing link was, quite honestly, our office and our willingness to come together, and that's at the county executive level. So what we said was, listen, we're going to get in the room, we're going to work on this really kind of quietly and figure out how we can begin the process. We're not going to solve it in one meeting, but over steps. And so what you see today is really the first great big step, and that is the MOU signed by all of us. You know, I have to say, you know, Kenny Glover did a great job bringing the hospital in and making sure that the finances, because we were holding him tight. You know, we were holding our money tight. You know, and he did a great job doing that, or we couldn't have got here. And the commitment from you and from the governor's office and everybody. So what it means for us in Prince George's County is we are committed. That's really what we're here today to tell you, that as county executive, Chair Turner, and the county, we're committed wholeheartedly to making a permanent solution, to finding a way every step that we go through that this works out. Because I think it has implications that live beyond Prince George's County. Mm-hmm. Like I said, not just for the southern region of Maryland, but the impact it's going to have on our neighbors in Washington, D.C., because health care doesn't know there's no Berlin Wall, as I often say. Health care crosses boundaries. So how we have a regional medical center that works with our hospitals and our clinics throughout Prince George's County in this area, in the southern part, is important for the way that we do health care for the next 20 to 30 years. And so our commitment is that we're going to do everything that we can at the county level. In fact, it is such an important part of the administration that even before taking office, I had my deputy CAO for operations and for finance, Brad Seaman, right after I won the primary, I said, you go start working on this, because it is a critical issue. Education, public safety, and health. A lot of what happens in the county circles around health care. Problems we see in our schools are health care issues. Problems we see with employment have to do with the ability to afford health care and access to health care. And so it's an important issue that we recognize. And so our commitment before you today is that we're going to do everything we can. We're going to use the resources that are available to us. I think I sent that signal in our budget when we took money out of our fund balance and set it aside not just paying what we said we were going to pay to the hospital, the $15 million, but also setting aside $20 million in our fund balance in a very tight budget year, that to send the signal that this is important to us, and that we're going to put the manpower and the woman power and resources to it. So with that, we're prepared to answer any questions and to let you know that when you hear from Prince George's County, it is one voice. It is one voice. You will not hear 2 or 3 separate voices. We will not come down here with one plan and change it when we get somewhere else. It is us. You know, I think, and I'm going to turn over to the chair of the council, but I think it speaks to our commitment, the fact that during, you know, a break, a vacation, a recess, that the chair, you know, changed her schedule and came to this hearing to show that, you know, we are together on this. And so with that, Mr. Chair, I thank you.
Very good. Let's hear from the chair of the Prince George's County Council, Chair Turner.
Thank you, Mr. Chair, and Mr. Speaker. Nice to see you. Only thing that I would add is that, as Mr. Baker has said, that this is a bold action. We know that there has been challenges before, but we think that this is a great solution not only for Prince George's County, but for the state of Maryland. And I'm here to tell you that the Prince George's County Council is behind this plan. We support this plan 100%, and we support Mr. Baker on these efforts. So thank you.
Very good. Questions? Let's hear from Senator Astle, then Delegate Elliott.
Thank you, Mr. Chairman. Ms. Quattrocchi, I've been in this legislature a long time. Forgive me if I'm mistaken. It might seem like it's something, but we've been wrestling on Prince George's Hospital for a long, long time. Can you tell me why you believe that this approach is the one that's going to resolve the problem when we haven't been able to do this in the past?
Yes, thank you. Thank you, Senator. The difference here, and I appreciate what you're saying and the sentiment behind it, and I've, you know, not been here as long as many, but I've worked personally on this for a long time. The difference is that we have a real collaboration and a real partnership among the signatories to this document. And I will share that the process of coming to reach agreement on this MOU was so productive and so collaborative. Everyone recognizes the challenges that still lie ahead, but what the difference here is that we have a terrific, you know, willing and able partner in the university medical system that wants to make this solution work. We have the leadership here in the county that's united for the first time, united among itself and then with us. And so, you know, I don't mean to minimize the challenges ahead, but I will say that the governor and the lieutenant governor, Secretary Sharfstein, we're all very committed to working through those challenges, not that, you know, and the financial ones will be the toughest ones of all. But we're committed to doing it, and we think we have partners who are equally committed.
Well, let me ask you about the financial issues. In the preamble, you estimate that it's going to cost $600 million to make this program come to fruition. Where is that money going to come from?
Well, in step, as it sets out in the MOU, step 2 of this process is to answer that question. And that's not a question that I can answer here today, or even, you know, the governor could answer here today if he were here. We're going to have to bring everybody together, including leadership in the General Assembly, all the members of the General Assembly, to figure that out. It will be a shared responsibility among all the parties to the MOU. And what I can tell you is that we're committed to being creative and innovative and collaborative in working through that.
I appreciate creativity and innovation, but at a time when every level of government is struggling to find revenues just to make the essential services continue to work, it seems like a pretty big number, even if you share it across the board. So is there a backup if you can't find the resources necessary to meet the estimate of the $600 million?
Well, I think, and clearly we have some very, very smart people working on this, and that doesn't include me. But what I can say from the county perspective is that we recognize it is a big number, and clearly we have our challenges, in our budget. But what I've said to our folks is, this right here is actually driving some of the costs, driving up the costs in Prince George's County. If you look at the impact of healthcare and the lack thereof. So if we don't get a handle on this, we're gonna pay for it one way or the other, quite honestly. So what I've said to our folks is, yes, we have a fund balance, and no, we can't spend the whole fund balance. But we can look at some ways that either, I think working with the state, with HUMS, with all of our partners, look at ways that we're going to put up, we're going to figure out ways to get our share of the money in there. And then working with them to figure out ways to help pay for this. And I think that's what it's going to cost. That's why we're doing it in phases. I think maybe some of the mistakes in the past is trying to fix it all at one time. This, we're taking it in steps. Part of it is, we hope the economy turns around, but the other part is making sure that, our budget people are sitting in on this and making sure that we have the adequate resources and wherewithal to live up to our part.